Hi, I'm Mike Carberry. I'm a chiropractor and I'm the founder of Advanced Medical Integration. And I get asked by a lot of people, what is your philosophy on healthcare? What is your viewpoint on healthcare? And of course, this is just Mike Carberry's viewpoint, but I'm willing to share if you're willing to listen. So let me just start off and talk about, I told the story on previous videos about how I got involved in healthcare, and I got involved as a patient. And my background is from the viewpoint of a marketer, because my undergrad degree is in marketing, so a business person. And when I look at healthcare, I've learned a lot over the last quarter of a century being involved, or 30 years being involved in healthcare, going through my education process and practicing, and having very large successful practices. And from a very early point in my career, 1996 is when I first looked at integrating and putting medical practitioners in an integrated system. So I have a pretty big experience background. I also read a lot. I had a radio show for 4 years. I did that radio show with a compounding pharmacist, and his name was Ben Briggs, great guy, influenced me tremendously in my career, gave me insights on things I never thought about, gave me knowledge on things. I'm very eternally grateful to Ben Briggs for that, and his son Mike, who's also a compounding pharmacist. And so basically, I've formulated opinions, and I've often looked at myself as being in a very unique position as a chiropractor or in healthcare in general because of my background and who I've been exposed to. I have direct family members that were top executives in pharmaceutical companies. I have, all these affiliations with some really tremendously knowledgeable people that I've met over the years. Tom Rosell, president of International Kinesiology Association. Mark Schwartz, a functional medicine guru in Philadelphia, who's just tremendous impact on my career and things that I've learned. I studied a lot of nutrition. I think by 1999, I had almost 200 hours of continuing education on nutrition. So I've learned a lot about nutrition, and having that radio show just really helped a lot because I read incessantly to get material for that show every week, and it became a very popular radio show. So, and I've lectured a lot based on what I've learned, and I've learned a lot from just meeting other doctors. AMI is quite large, and we have a lot of clinics in probably 46 states that are clients of putting on our model. And then I'm married to a physical therapist, so that viewpoint also is different because, when I went to school, some of the professors at the school I went to were talking about the medical doctor being the devil and the physical therapist being the devil. And that's not a true statement. I can understand why they felt that way, but it was a wrong target. I think there is a conspiracy in healthcare to sell drugs. I do believe that. I believe there's a hidden monopoly. And I'll share with you some of my viewpoints, as right or wrong as they may be, but why I personally believe that. So back when I first started medically integrating, I hired 3 medical doctors. They were all great guys, and I learned a lot from them. They all brought different viewpoints to the table. We had 2 part-timers and 1 full-timer, so we always had 2 MDs on site at any given time. And then over the years, we've started bringing nurse practitioners in. I've worked with a lot of great nurse practitioners and a lot of PAs, just phenomenal clinicians. And I remember we had this one clinician, she was a PA, she was a young girl. She came in, she was applying. I'm thinking, this girl isn't going to have enough experience. I said, all right, so I look at her resume, and she worked in a prison. I said, so tell me, what'd you do in the prison? She said, I was the only clinician in the prison. So I said, okay. So I had to handle anything that came about. All right, give me an example. Well, last week I stitched a guy from this wrist to this wrist. I'm like, well, I've never met anybody who did that before. She said, I've done tracheotomies. I've done emergency surgeries. And I was blown away. This young girl had this tremendous experience, and she's smiling the whole time. She was a great clinician. I don't know if she wants me to use her name, but I'll just tell her it was Anne Marie was her first name. She was a great clinician. But I've had a lot of great clinicians. The nurse practitioner I work with now in Chattanooga, Bency, phenomenal clinician. She doesn't know how phenomenal she is, and I have to keep telling her, no, she has the right ingredients. The right ingredients is patient first, compliance second, profits third. And that's always been my viewpoint as well. So let me tell you a little bit about how I came about and how I learned these different viewpoints and what those viewpoints are. I have these 3 MDs working for me, and they came to me at one point in the late 1990s and said, there's a problem. Our our medical association of Chester County, Pennsylvania, a lot of the doctors want to go on strike. I was like, what? Strike? I've never heard of medical doctors going on strike before. Oh, it's happened before, but I'm like, why would you go on strike? And they said, well, this year they told us when we join the Chester County Medical Association, which we all do, they actually want to give us free enrollment in the American Medical Association. I thought that was strange. And I said to them, aren't you all members of the American Medical Association anyway? Oh no, that's the drug companies. I was like, what? That doesn't make sense. That's the first I ever heard of this. But then I heard when the Affordable Health Care Act came out, and President Obama was on TV, and he made an announcement that doctors are behind this health care bill. We've been endorsed by the AMA. I was reading the paper, and I come upon an article which is on the back page of the first section that says the president of the American College of Physicians and Surgeons came out and said, we don't support that plan, and we are not the AMA. So I'm like, okay, that's the second time I've heard that. So I started doing some research, and I started looking, and in the last 20 years, historically, the AMA's enrollment rates have fluctuated somewhere between 8 and 20%, but no higher. And when you look deeper, and I just Googled this before I started filming this video today to make sure my numbers are accurate, 2016, they're saying it's 15%, but there's no way of knowing how many of those doctors have free enrollment from the AMA. So, okay, a lot of them are medical students and interns that are given free enrollment. I hear that a lot of retirees are being given free enrollment. Why would the AMA be giving away free enrollment? Why would the AMA's numbers be so low? When you look back into 1950, it was 75% enrollment. So what happened? Well, you know, you got to look at the money trail. And so I've read articles, and I haven't done this investigation myself, but this is the information I got from reading. And a lot of the money for the American Medical Association comes from the American Pharmaceutical Advertising Council. And I go, that's a conflict of interest. That is a monopoly. The American Medical Association has the authority to set the standard of care for all doctors. And a small minority of doctors actually belong. And of that minority, some of them are given free enrollment to boost the numbers. And the American Medical Association owns the billing codes. So you start looking at this and you go, so the insurance companies, when they go to pay for a service in healthcare, who do they turn to find out if it's a viable service? The AMA. And who's funding the AMA? Pharmaceuticals. Is that real or not real? I don't know, but it's certainly worth looking at. It doesn't take much time to go on the internet to find this information out. But if that is true, which I tend to believe it is, you have a money trail that is eliminating anything that doesn't result in a drug. Let's just look at this for a second. Chiropractic, one of the best treatments when you do studies, one of the best treatments you could ever have for a patient who's suffering with back problems is chiropractic. Yet less than 10% of the population go because of the amount of information out there that makes chiropractic look dangerous, expensive, and a ripoff. Well, that's unfortunate because it denies a lot of people from getting care. Where are they steered towards? Well, you say, well, they go towards physical therapy. Well, physical therapy, as I work in this environment in 46 different states, and we're working with physical therapists and with chiropractors and with medical doctors and with osteopaths and with nurse practitioners and with physician's assistants, we're seeing the trend is also to cut physical therapy reimbursement. And when I went to school, I was taught physical therapists are bad. And when my wife went to school at Marquette University, she was taught that chiropractors are bad. Why are these professions being taught that each other is their enemy? I don't think the physical therapists are the enemy. I don't think the medical doctor is the enemy. I don't think the osteopath or the nurse practitioner or the PA is the enemy. I think the enemy is the one who's telling everybody to fight with each other. The enemy is the one who's telling the insurance companies what to cover and what not to cover. The enemy is the one who's pretending to be the authority in healthcare when really it's just a private interest of an industry that makes more money than any other industry or country in the history of Earth. And that's the pharmaceutical industry. Can we eliminate pharmaceuticals and say we don't need any more pharmaceuticals? No. I think if we did that today, people would die this afternoon, and that would be unfortunate. However, are we over-medicated? Yes, I believe we are. So if you look at those numbers, I've done research on this over the years, and I came upon a woman named Dr. Barbara Starfield. Dr. Starfield wrote an article which was published in JAMA in July of 2000, and she was asking, is America healthy? So she looked at some different statistics. The United States is 4.6% of the world's population. The United States, the healthcare bill for that 4.6% of the world's population is greater than the other 96%. That's incredible. That's incredible. We are outspending the entire rest of the world. So are we healthy? Is our system working? So Dr. Starfield wanted to answer this question. So what she did was she looked at the health of Americans in about 200 different categories. And she took those statistics and compared it to the top 12 industrialized nations in the world. So a total, including the United States, of 13 countries. And she ranked us from 1 to 13 in all those categories. And what she came out with was some pretty startling statistics. The one she published first was, she said, when she looked at it, the third leading cause of death in the United States was side effects from medical treatment. And by far, the largest numbers of those deaths came from reactions to properly prescribed drugs. There was 106,000 Americans in that study. This was back in 2000. That's staggering. Then she looks at how many people catch an infection when they go into a hospital. That's 80,000 Americans. Then how many people die from mistakes made with medication or surgery? And you got another 20 to 30,000. And then you start looking at, in total, it came out to be 225,000 Americans die from the side effects of medical treatment, making it the third leading cause of death. And she said in her study, she only counted deaths that were in a hospital setting, not private practice, and as far as I know, not in nursing homes. So in a hospital setting, and that was the number of deaths that occurred. She said if you started looking at other incidents of private practice and so forth, that number could rise. It could actually go to maybe number 2 or maybe even number 1. She also said typically doctors are discouraged from reporting side effects from treatment as the cause of death. So who knows what that number could be. But that study was repeated in 2013 by the National Institutes of Health, and this time they looked at 17 countries. And in both studies, the United States came in dead last. Our healthcare bill is greater than the entire rest of the world combined, and we are coming in consistently in last place. That's a discouraging statistic, very discouraging. I think when they rank us in the whole world, we come in like number 36 to 45 or somewhere in that range there, which is very discouraging. We should be in the top 3 at least. If we're spending more than everybody else combined, we should actually be in the top 1. So obviously, our healthcare system is more expensive than the rest of the world, yet it is less effective than the rest of the world. And why is that? Well, one of the viewpoints that I look at that I find to be very discouraging is how Americans and how doctors in this country view health. In the late 1990s, there was a movement to qualify pain as enemy number 1. Pain is enemy number 1. That is the biggest problem, pain. Pain is a symptom. It is not a condition. It is not a disease. Pain is a symptom. Symptoms occur when your body tries to fix something. So where they targeted this first was with the VA. And they said it is wrong for our soldiers to come back and be in pain. We should do something about that pain. Now, a lot of this movement was funded by pharmaceutical companies that were making opioids. And if pain is number 1 enemy, what's the number 1 treatment? Pain medication, pain management. So the opioid use in this country started to skyrocket. Opioids are drugs that are made from the opium plant, like heroin. Now, they weren't using heroin, but I'll just give you some background on heroin. The reason heroin is called heroin, it was a tonic that was made from opium back in the 1900s or late 1890s, and the idea was to make pain, to help the mother, who was the true hero of the family, who had to work all day with no recognition. She had a chance to relax in the evening, and she could use it because she was the heroine of the family. And that was the product. And the company that made it, I believe it was Eli Lilly, but that's disgusting. Here's a drug made from opium to help a woman relax because she's the true hero of the family, and the feminine version of hero is heroin. And that's how that word came about. Well, they're not prescribing heroin. What they're prescribing is OxyContin, which a lot of authors argue it is more expensive than heroin. It is more addictive. I'm sorry, yeah, it is more expensive than heroin, and it is more addictive than heroin. And what's happened is there's been so many opiates prescribed in the United States in the last 15 to 20 years that we have now, one of our biggest issues in healthcare is addiction to these drugs. And what happens is when you start to use these drugs and you get addicted to it, and then the doctor goes, oh my gosh, I made a drug addict out of this person, I'm going to cut him off. Well, then they have to buy it on the street. Well, the going rate for opioids on the street is anywhere from $10 to $40 a pill. And the going rate for a heroin fix is about $1 or $2. So what do you think is going to happen? These patients are turning to heroin, and we're creating heroin addicts. And heroin has returned again as the #1 addictive drug in the United States. And most of these cases are coming from people on opiates. But even that being aside, deaths related to opiates, not heroin, but from the pain management, it's ridiculous. It's every 12 minutes in this country somebody dies from the side effects of an opioid drug. There's 650,000 opioid drugs prescribed every day. And what is the #1 condition, or the #1 diagnosis that results in that opioid prescription? Back pain. I look at that and I go, that's a big failure rate for me as a chiropractor. I should be treated, they should make it mandatory that these people have to do a regimen of chiropractic care, and not like 5 visits, but actually a care plan that will enable these people to get fixed. If you look at it, most people that have chronic degenerative arthritis, it comes from an injury they had years and years earlier. If you look at arthritis and you start to break it down in its basic components, it's a lack of movement creating a decrease in nutrition being pumped into the compartment of that joint, the synovial capsule. The synovial capsule has a barrier and it prevents blood flow from going into that joint. If you had an artery going directly into that capsule, you would either bleed into the joint or have synovial fluid leaking into the blood system. So there's a barrier there. And the barrier is the synovial capsule that allows the transfer of nutrients across this barrier as long as there's a pressure change inside the joint. And how does that pressure change occur? Movement. So if you decrease movement of a joint, you'll get less nutrients across the joint. It's like tying a string around my finger, not completely stopping the blood flow, but decreasing the blood flow. That finger is going to suffer. And that's what happens. And it does it silently for years before the symptoms start up. So when the symptoms start up, most people think, I just got this problem. No, you got that problem when you had the car wreck in 1993. You got that problem when you fell out of the helicopter in Vietnam. That was a true patient, came in, had back pain, and he's like, I don't know why I got it. What happened? Well, I don't know. And we started pulling the string, digging deeper, and found out, well, yeah, when I was in Vietnam, I was under fire, and I put my one foot on the rudder blade and grabbed the hand of one of my partners, and they were taking off, and I was going up, and I slipped. How high were you? I was somewhere between 20 and 30 feet in the air and landed on my back, right on my tailbone. And where's his degeneration? L5-S1. And he had to lay there under fire because the helicopter had to take off and wait until it was safe to come back in and pick him up again. It's stories like this that bring people to that injury, to that degenerative process. And what are we doing? We're trying to address the symptoms, which was the last thing to show up and usually the first thing to go away. But we're doing it with addictive medication, which means even after the pain's gone, if it's gone, they're going to still reach for the drug. It's terrible. We have to stem that tide. We have to change our viewpoint away from symptom is the enemy to function is the target. Is your function correct or is it not correct? If you're treating function, then it doesn't matter if they sign 0 on that pain scale when they come in your office, you're assessing it based on function. This is how a physical therapist thinks and treats. My wife is a physical therapist. A physical therapist does not assess their care on how do they feel. If you have a patient come in with a rotator cuff problem or a frozen shoulder and the arm's in a sling, they're not in pain while that arm's in the sling. But when that physical therapist takes the sling off and starts to move the arm, they're going to start to experience symptoms. So physical therapists do not judge their care based on symptoms, but rather based on function. And I know a lot of chiropractors say, well, I do the same thing. And we tend to do that. But we also, when we went to school, we learned an exam that went kind of like this. Does this hurt? Does this hurt? Does this hurt? Does this make it feel better? So we're, feeding right into that symptomatology problem. We have to shift our viewpoint away from measuring function, from measuring symptoms to measuring function. And that's what we do at AMI. I think the future of healthcare is that shift. If we don't make that shift, we keep focusing on function, well then our bullets are going to be what's the thing that takes, if we keep focusing on symptoms, then the treatment of choice is going to be what's the bullets that get rid of the pain. And that's where we've been for a long time. And obviously it doesn't work. We're failing in our healthcare grades. You ask the average American on the street and 90% of them say, yeah, our healthcare in this country stinks, but I don't know what to do about it. Well, that shift to assessing function, which means the doctor has to learn new skills. The doctor has to be able to evaluate, why is this muscle tight? Is that really the problem? Or is it this weak muscle that's making that tight, producing the symptoms? And then I have to strengthen that weak muscle. And you have to have ways to measure that. That's what our program has. We have woven into it ways to assess the body for a function. And we're not looking for pain, although that is a concern of ours. When a patient comes in pain, we don't want them in pain, but we're not going to cover up the pain at the expense of not addressing the function. That would be akin to driving down the road and having your oil light come on. There's a symptom. Oh, I have a problem. That's exactly what happens when people have a pain. Instinctively, people know when that oil light came on, that's not the moment that problem began. It had to begin before then. So if our way to handle that is say, well, here, I have this opium paint, and I cover that up. Now I don't have that light on anymore, and I can continue to drive. You know what's going to happen to the car. It's going to break down at the most inopportune time and leave you stranded by the side of the road. When it happens with your body, that leaves you stranded by the side of the road, and that could ruin your life. So we need to shift away from the viewpoint of symptoms is the target to function is the target. If we just did that simple thing, all of a sudden, many new therapies would open up. You look at stem cells. Stem cells or regenerative medicine, if they can help lubricate a joint and cushion a joint, and if miraculously somehow this therapy stimulated either your body or the stem cells that were put in, if they were put in, to regenerate that tissue, well, then that's a functional improvement. It helps to buy back some of those years we've lost. And it's fortunate right now, we didn't have this therapy when I first got out of school. There was no miracle thing to say, oh, your knees are degenerated, let me inject this and we'll take an x-ray in 8 months and see increased space there. And you're saying, oh, I can do stuff I haven't been able to do in 40 years. That wasn't around back then, but it is around now. We just got to make sure that we don't kill that goose that's laying the golden egg by attacking and fighting with each other. I think the monopoly or the conspiracy of monopoly created by the pharmaceutical industry, which I do believe that's true, also incorporates divide and conquer. Get the pharmacists fighting with the doctors who fight with the physical therapists who fight with the chiropractors, and nobody's working together. Keep all those professions distracted and fighting with each other, and nobody will pay attention to the big elephant in the room that's obvious, but nobody even recognizes it's there. It's right in front of our face. The conspiracy is so close to us, we don't even see it. Big pharma makes big money. You don't have to go far on the internet to know that. They make a ton of money. And it shouldn't be about money. It should be about patient care. And if you look at the statistics of our patient care, it is horrible. We need to shift this viewpoint away from symptom treatment and start to focus on improving function. If we did that, I believe that our healthcare system would change for the better dramatically and in a very short period of time. That's my thoughts. I'm glad you listened, and I'll be back with more thoughts. Thanks.